Okay, here I am. Good morning, good afternoon, colleagues, friends around the world, wherever you are. Today, I am interested to present a topic on malnutrition and the possibility of social and behavior change to curb nutrition related challenges. As you can see from my screen, the title says the $1 trillion hunger economic cost of malnutrition and strategic potential of social and behavior change in our current era. So moving to the second slide, I will be talking about undernutrition and overnutrition. When we talk about malnutrition, most of the time, what it comes to our mind is undernutrition, which is stunting, wasting, blah blah. But the cost of overnutrition also need to be considered, as it's costing us $1 trillion annually. So the cost of undernutrition, as you can see from my screen, it's costing us $761 billion annually, and this is called the cost of inaction. I mean, this is preventable undernutrition, including stunting, anemia, drain at least 3 to 4 points of national GDP in high burden countries. This is driven by child mortality and lifelong healthcare costs for survivors of malnutrition. As you can see from the screen, this is another cost. The cost of increasing non-communicable diseases are projected to consume 3.3% of global GDP by 2060 if the behavioral trends are not reversed. I mean, if we continue consuming the way we are consuming, if we continue following the same behavioral pattern on our diet system, the global economy will cost 3.3% of the total GDP by 2060. That's why we have to seriously question how we invest in social and behavior change to curb this economic loss beyond human loss. So the loss of human capital is another thing we have to question. So they call it the hidden drain. Malnutrition in early life results in an average loss of 10.8 IQ point per child. This is very serious. This cognitive deficit reduces lifetime earning potential by 20%. If someone loses his cognitive potential, lifetime earning potential will be reduced by 20%, permanently shrinking the workforce capacity of entire nation. So, if a certain country is affected by malnutrition, especially children and their early age of malnutrition, it is costing the entire nation about 20% of productivity. This is very serious, and we have to consider curbing it now. So, how social and behavior change will help us to address those nutrition-related burden? The behavioral shifts are the most cost-effective global health intervention we need to consider. When we talk about how social and behavior change help us cover the cost or the economic loss, if we invest early, $1 investment will return 16 times in the late life of every child. For every $1 invested in behavioral nutrition program like breastfeeding promotion, hygiene and sanitation, the global economy will realize $16 in increased productivity and health saving in the late life of every child. So these are the area where we can intervene early. Exclusive breastfeeding. Early initiation saves around 507 billion annually by reducing infant illness and mortality. The second one is diversifying feeding. Scaling behavior change around complementary feeding reduce stunting by 30%. This is very massive result. So the third one is wash norms. Social and behavior change driven hand washing prevents infection related nutrient losses in every child, specifically in developing countries. Reclaiming the plate. Combating overfeeding is another area that we need to give enough attention. The nutrition transition is shifting global diets towards ultra-processed food. SBC campaign that reframe traditional diet as aspirational can save health system $1 billion every year. Targeting normal round sugar, drink, and snack portion can avert 5% of non-communicable disease costs annually. So how do we intervene? So with the age of AI and the digital age, social and behavior change can be modernized. Modern SBC leverages AI-driven digital nudging. Real-time feedback in via mobile platform helps caregivers monitor child growth and adult track calories quality, making the healthy choices the default choice in urban environment where people do have access to a smartphone. So a call to behavioral action. The first one is policymakers need to consider integrating SBC in their policy, move beyond education-only model towards a choice architect in food markets. Local rebranding, repositioning local whole food as status symbol to combat malnutrition. The third one is sustained funding. Treat social and behavior change as a core economic infrastructure, not a pilot project. So for today, this is the whole presentation I have. If this is something interesting, I will continue bringing more ideas for discussion, and I will be presenting more important public health problems that can be addressed through social and behavior change that will result in a high impact. Thank you so much for watching my YouTube video. And if you like and comment or subscribe, I will be encouraged to do more videos. Thank you.